Hi, I'm Dr. William Stiles. We're talking about treatment options for kidney stones. And when you have a kidney stone, everyone would like to pass their stone without having intervention. And passing that stone is the first type of treatment, is just trying to pass the stone. Stones can pass, it may take a day or it may take 3 or 4 weeks. But just giving the stone time to pass many of these stones that are in the urinary tract, in this ureter, this tube right here is called the ureter, and it's the tube that connects the kidney to the bladder. A kidney stone can happen anywhere along this tract, and I'll make the kidney stone in green, and this would be a stone that's up high towards the kidney, still has a longer way to go. That would be in the proximal ureter. This is a stone that would be in the mid-ureter. Excuse me. Excuse me. And this would be a stone in the distal ureter. And so passing a stone, a lot of it depends on a lot of different factors. Some of the factors that tell you whether a stone will pass, the most common thing would be the size of the stone. So the size of stone is very important. And just based on the size, you have an overall idea of what percentage chance you have of passing a stone. So a stone that is 1 to 4 millimeters, that stone will be passed, 85 to 90%. 4 to 6 millimeters, now you're talking 60 to 70%. 7 millimeters or more, that drops to 30%, 20, 30%, something like that. But as the stone gets bigger, there's less room for it to pass. Now the stone, not only the stone size matters, but these stones are usually fairly jagged and irregular on the outside, and so they can irritate the lining of the tube and cause swelling. And so you may have a small stone, but because it's irritated the lining of this ureter and it's created swelling, now that stone can't pass through, not just because the small stone, but because there's swelling in that tube, which is inhibiting it from passing. So stone size is very important. Stone location. A stone that is up high at the kidney, it has to travel down this tube all the way down here until it reaches and passes into the bladder. This would be the bladder here. That's the kidney. But a stone up here would it takes time, and it may take, again, a few days or a few weeks for it to pass on through. And usually as a stone passes, the symptoms will change. Instead of having back pain, now as the stone moves distal or towards the bladder, the pain usually changes more towards the front side, the groin, and into the, even radiated pain into the testicle or groin is often common. So, stone size and location these are two of the most important factors on whether or not you can pass this stone. A distal stone that's a millimeter, that stone is going to pass 99% of the time. A 1 centimeter stone in this proximal ureter, it's probably not going to pass. And in those are the patients that I say, all right, you can wait on this. You can watch this stone, give it some time to pass, but the chances of this stone passing are very low. And in those situations, we start talking about treatment sooner rather than later. So, a lot of it with stone management, again, size matters and location matters. Where in this kidney the stones are located. There are some things you can do to help pass this stone. One is hydration. You know, as your kidney makes more urine, this urine is going to push this stone down, and so hydration becomes very important. There are medications, pain medications, non-steroidal anti-inflammatories, even like alpha blockers like Flomax can help pass these stones. Steroids have been used, calcium channel blockers have been used to help pass stones. There's all these different medications that you can use to help pass these stones. And so medications are helpful in passing these stones. Stretching is helpful. If you can stretch this area in your back, the whole flank on the side of where this stone is, and stretch that area, these stones will pass better. They will pass better. Staying active is important. You know, just moving, still doing your normal activity and moving around, you know, as you would. That staying active is going to help you pass, you know, a small stone. So these are some basic things that you can do to help pass your stone. A lot of it is just giving it time, and hopefully, you know, your pain doesn't get to a level where either you need to call your urologist or go back to your urologist or go to the ER. But you know, staying comfortable. These things hurt. Stones hurt as they're passing down this tube and into the bladder. They hurt. So staying comfortable with medication is incredibly important. So I'm Dr. William Stiles, board-certified urologist, talking to you today about passing kidney stones, one of the many options for treatment for kidney stones. Don't forget to watch us on urologyanswers.com to get more answers about your urology questions.